Hi ladies, it's Elisa and we're home, or more to the point, Sawyers Home. So you guys will get better pictures of him later. So we have been home for 6 days, and I'm so sorry that I have not updated you guys sooner because I filmed a whole video about his last surgery, and I completely forgot to upload it because then we were getting closer and closer going home and there was chaos. So you won't ever see that video. It has been deleted. But Sawyer's home. So it was crazy. I'm not even going to go into all the details of the chaos surrounding our discharge, but it was like a hellacious 2 days. It was awful. And they couldn't get all the equipment that we needed delivered. And then there was confusion about what equipment we needed between the Kaiser and like the manufacturer place that you get it from. Oh my gosh, it was crazy. Anyway, they were like, normally it's not this complicated. We're so sorry. And of course, I'm like, it's our luck. Of course it's complicated, right? Of course. So we got discharged in the evening, like around 4, and we came home. My whole family was standing in the front yard, and they had decorated our garage and stuff, and it was pretty awesome. It was a great way for him to come home and see our street and our house for the first time. So, it has been crazy whirlwind of the past 6 days. The things that needed to be accomplished before he got discharged were that he did need to get a G-tube placed, and that is when they put the feeding tube, I don't know if I've explained this to you guys in the last videos, through your abdomen wall into your stomach, and it's a little tiny tube, and so it's basically like a pool floaty button that opens, and that's how his food is inserted into his stomach, because they decided that the NG tube through his nose was just not an effective long-term solution. So he's actually eating right now, shockingly enough. I'll show you guys this right here, this pump, and that's his formula and breast milk combination, and it's going in here through this white tube right here and into his belly. So that's what we have to do to feed him for now. We are working with a speech therapist to try to get him over his oral aversion, so hopefully sooner rather than later we can get the G-tube out and he can eat like a typical child. Yeah, he's just staring at the world behind him. It's been great having him back. He did come home on oxygen, which is, here, let me see if I could show you guys. This tube right here, he's on a nasal cannula that I'll show you when I turn him around. And he's only on 0.25%, so only on a 1/4 liter of oxygen, which is a really low support amount, but we did try to take him off of it and see how he did. And after about an hour, it was pretty clear that he was just not quite getting the numbers, the oxygen numbers on his own that they want him to have. So we do have follow-up appointments with a pulmonologist regarding his breathing. To get off of this support, he will have to do an overnight study where he stays in the hospital overnight and they take the cannula off him and see how his oxygen numbers do overnight. We're hoping this is short term. I think the doctors think it's going to be short term, but we don't really know. His heart could probably still just be recovering. Not his heart. Because of his heart surgery and how it affected his lungs, it'll probably take longer for his lungs to heal. Just like pneumonia cases take forever. You're coughing for forever after you have that. But yeah, so he's on oxygen and he's on 4 different medications. After his surgery, he was experiencing high blood pressure, and they're worried about his thyroid, which is a common problem with babies with Down syndrome, thyroid issues, and he has very slightly elevated levels, so he's on one for that. Because he is still taking the pill that's a diuretic that helps him get that extra fluid, keep it off of his lungs, that affects your electrolytes, so he's also taking sodium. So he's on 4 different things, and they're all at different times, and it's a little chaotic. And all of those meds are actually given through his G-tube, so it is crazy. It was, the doctors made sure to make us understand before we left that it is not going to be easy having him home, and it is not easy, but it is awesome. He's getting to wear his cute little clothes now, and sorry, flailing baby, and he's got really good neck control. I know that babies with Downs have low muscle tone, but he's doing really well. We're trying to do tummy time, and um, he's just awesome. You know, he's getting into the routine of being home with me, and I'm taking 3 additional weeks off work. Oh, goodness. I think he just wants to say hello to you guys. That is the thing. Oh, say hello. Say hello to your public. Yes. And his shirt says the book was better, because it always is. But yeah, so this is Sawyer James. And yeah, so we're home, and he's doing good, and he's happy. We've had some visitors. Because of the heart surgery, his cardiologist actually doesn't want him to have his vaccinations. They usually, I guess babies get them around 2 months or something. But, his are actually being delayed until he's going to be just over 3 months old. So in October sometime he's going to get his. Hello, here, okay. So yeah. So yeah, he's going to get his vaccines, but they're going to be a little delayed. So we've been trying to be selective with our visitors, and the doctors don't really want us taking him out places like Target visits and, you know, crazy things like that until he gets vaccinated. So we're just going to try to be diligent and make people wash their hands, and hopefully that will stop him from getting any more sicknesses, because we've had enough of those in this house. We've got some large oxygen tanks that he's connected to in the house, which are kind of a pain. They're not super heavy, but you have to drag them around with the baby, because we haven't gotten one of those travel carts yet. We're going to, but we haven't gotten one yet. And we have travel size, like to-go air containers. I'm looking over there because that's where they are in my house. You guys can't see them, but trust me, they're there. And they're, you know, the size of like a wine bottle or a 2-liter bottle. But yeah. And so that's my mom. She's just mouthing to me that she has one of the containers, carrier things in her car. So, this is life now. My house looks like a baby bomb exploded. I thought that we were ready for Sawyer before he came home, but we were not. I mean, the few nights before we brought him home, we were shampooing carpets and vacuuming, shampooing carpets, dusting everything again, and, you know, setting up things like his bouncer that had just stayed in a box, and, you know, just crazy things like that. We thought we were prepared, and then we realized the night before that we really weren't. So, life is crazy now. I feel like I'm busy all the time. You know, cleaning up after something, doing dishes, laundry, and managing to spend time with this cutie patootie. And we're all worried about him getting spoiled, but I guess you can't really spoil a baby, right? Because he prefers to be held. This is his preferred position all the time in life, especially when he's eating, because I guess it's easier for them to digest when they're up and about. See, my mom's trying to be sneaky, but she's going to be in the scene. So, that's it, ladies. We're home. It's chaotic and crazy and just super awesome. Brian has been great, and it's been really fun and getting to know each other. He's getting to know me, I'm getting to know him, and we're smiling now. We're getting lots of baby smiles, not just sleep smiles and not just farting smiles, but genuine happy baby smiles. And what else? He's taken a few car rides with me, and he doesn't really care for the car seat, but he falls asleep the moment we're in the car and it's moving, which is, I think, a typical baby thing. He loves a swing. He loves being pat on his back or his leg. It's like his go-to soothing move. You look like a drunk sailor. Yes. But putting him in his clothes, super fun. We put him in a ducky outfit yesterday that was highly embarrassing for him, but super awesome for us. Yes, you want attention now? We have some sleepy eyes, ladies, so I should probably go. But, yeah, we're home after chaos. So, he actually came home 81 days after he was born, spending his first 81 days of life inside of a NICU, various NICUs, not even just one. Kids spent more time in an ambulance than he probably has in a car so far. But yeah, we're all really happy. His sisters are really happy. Oh, and see, look at, he always wiggles the most right before he crashes. So yeah, it's great being a mom. It's great having him home. But let's see. I think this video is probably long enough for you guys. But yeah, if you have any questions, leave them below. And yeah, it's crazy. We're home. So I don't know what my videos will be from now on. Talking about the craziness of life with a baby with special needs and tons of medications and stuff. And maybe eventually talking about frozen embryo transfers, because I'm already trying to work Brian for that, trying to talk him into it. But it might be some time before we actually get that. And I want you guys to be able to see his YouTube when he's not wiggling so much. I'll be able to show you. And his little scars. But yeah, he's doing great. We're doing great. We're pretty happy. He's pretty happy. He's gonna be spoiled rotten. Everyone loves him. And these cheeks, how can you not love them? Alright, ladies, I will be talking to you, and thanks for watching.